Hello, my name's Naomi Wallace and I will be presenting a quality improvement project that I completed as part of my doctoral programme. The quality improvement project was reducing stress in critical care nurses. So what is stress? In order to reduce stress, it must be understood. Think of the last thing that made you feel stressed. A survey in 2021 asked 2,000 people in the UK what situations they felt were the most stressful. From the top 30 answers, they ranged from health problems to traffic, from family problems to your clothes not fitting. Their results show that minor things can be as stressful to some people as major things, and any given situation is unique to each individual. Occupational stress is stress that's directly related to a job or profession. Again, this is an individual perception. Some people look for a job that's high in stress, where others avoid them. The Occupational Information Network, which is part of the US Labor Department, ranked 837 jobs in order of their level of stress, considering accepting criticism and dealing with stressful situations. Some of these professions included firefighters and call centre workers who routinely deal with difficult conversations or put their lives in danger. But of those top 50 most stressful jobs, 22 were healthcare professionals. Urologists came in at number 1, and acute care nurses and critical care nurses were numbers 6 and 26 respectively. Causes cited for occupational stress in healthcare are patient deaths, critical illness, difficult behaviours, increased workload, short staffing, and limited training and experience. When we look at the symptoms of stress, we can see that stress induces the fight or flight reaction, which releases adrenaline and cortisol, increases the heart rate, breathing, and dilates pupils. This can be an addicting feeling in thrill seekers, but prolonged periods of stress can be detrimental to your health and well-being. And this is also the case in episodes of negative stress. Symptoms can include depression, anxiety, headaches, sadness, anger, irritability, insomnia, hypertension, weight gain, and it's a major factor in burnout. These are not necessarily the symptoms that you want to see in your healthcare providers. So why is this important? According to the 2018 Physician Workload Survey, which was completed before the pandemic, 52% of physicians indicated feeling burned out and used unhealthy coping mechanisms such as alcohol, isolation, and junk food to deal with their stress. In 2022, the International Health Policy Survey found that nearly half of physicians over 55 intend to leave the workforce in the near future. On average, one physician dies by suicide every day. That's nearly double the rate of the general public. A recent survey by the American Academy of Critical Care Nurses found that 90% of the nurses surveyed believed that occupational stress would contribute to them leaving the nursing profession. While healthcare professionals may recognize the symptoms of stress, they are far less likely to seek help due to stigma, fear of losing their license, and other barriers. As healthcare professionals, we can't avoid stressful situations, and they often mean that we need to work longer hours, extra shifts, or take on an increased workload, which exacerbates the situation. Managing stress in healthcare is important as it affects individuals, facilities, and patients. As well as the physical and psychological symptoms that we've discussed, increased occupational stress is a major cause of burnout, which lowers staff morale and increases sickness, complaints, sentinel events, medical errors, and litigation cases. In short, staff burnout impacts the quality of care delivered and patient safety. There's a predicted shortfall of 18 million healthcare workers by 2030 and a cost of $47 trillion by the end of the decade. So to recap, we've identified that stress is unique to each individual. We know that healthcare professionals are associated with high stress, and reducing stress is essential for high quality patient care and safety. So how do we reduce stress? Mindfulness is a basic human ability to be present and aware of what we're doing, to not be overly reactive or overwhelmed by the things going on around us. Mindfulness has become a popular technique to reduce stress, and there's a great deal of research investigating how well it works in reducing stress in businesses and organizations. The possible solutions for reducing stress in healthcare are less well documented. Mindfulness uses a variety of cognitive and physical exercises to reduce overstimulation and anxiety. This is especially useful for individuals that have unique experiences of stress and provides a variety of ways to deal with stress. So the Quality Improvement Project, as I said, was based on reducing stress in critical care nurses. We have already identified that critical care nurses, as part of any healthcare professionals, are highly stressed, and this is a major issue when looking at patient safety in these areas. So the aim for the QI project was to reduce the stress of the critical care nurses, to provide a framework for a wider implementation to involve other healthcare workers and other facilities and departments, and to add to the current literature that's available, which is already limited. The methodology for the QI project involved using a convenience sample of registered nurses from the critical care department of the project hospital. The hospital had 5 intensive care units, and all registered nurses that worked full-time in those units were offered the opportunity to take part in the project. To identify stress levels, surveys were used based on the perceived stress score, and the same survey was used before and after an intervention. This way we could assess what the actual stress scores were before any intervention, and then decide if the intervention was actually effective at reducing stress. When I was looking at educational interventions for this project, previous studies had found low rates of participation, and some of the barriers included things like being able to take a break from their patients to be able to go to in-person sessions. They were limited by availability of instructors and just accessibility to people on different shifts, working different times, on vacation. So the educational intervention used in this QI project was online. The whole thing was online. It was available 24 hours a day, 7 days a week. It was provided through a website that every participant had their own individual login. They could work at their own pace. They could access it at a time that was suitable for them and in a place that was convenient. When we look at the results, you'll be able to see that there were only 11 participants in total. Of those 11 participants, 3 of them did not complete their post-surveys, which meant that there were only 8 pairs of data that could be used for the analysis. This was expected to have a low participation rate, but unfortunately it will affect the validity of the results that we found. The perceived stress scale is based on a score from 0 to 40. A low stress score is between 0 and 12. A moderate stress score is between 13 to 25. And a high stress score is above 25. The bars in the chart that are blue are indicating the stress scores of each participant before the intervention. You should be able to see from that every single participant had a moderate to high level of stress prior to taking part in the study. After they'd completed their educational intervention, which was expected to take about 4 weeks, they were asked to complete a post-survey. The questions were exactly the same, and it was aimed at observing the difference in their scores. You'll be able to see from the orange bars on the chart, that every single participant that took part had a decrease in their overall stress score. Some had a slightly different range. You can see that participant 1 there went from 25 all the way down to 3. Other participants had a slightly less dramatic drop. Participant 4 went from 14 down to 9. But every participant did find a decrease in their score. The overall average score for the pre-intervention survey was 18.36. After the intervention, that average score had decreased to 8.63. To evaluate the effectiveness of the intervention, a Wilcoxon matched pairs test was undertaken, and that found that the results were statistically significant. Even though there was a small participation rate, the study had a strong power of 0.9991, and the sample effect was 1.95. So, discussing the QI project and looking at the achievements. The project was successful. Every participant that took part found that they had a decrease in their stress levels. If the stress levels of the nurses are decreased, then that should stand to reason that patient care and patient safety will improve. There was excellent feedback from staff at the hospital, from their management team, from their education teams. There wasn't really any pushback from staff to taking part. There just was a low participation rate, which could have been from multiple factors, such as the time of year that it was taking place. The study was conducted over the summer, and so people could have been on holiday. Also, there had been a huge loss of staff, which was one of the reasons this study was undertaken at this facility, because a lot of staff had left following the pandemic. But overall, this was a successful project. When looking at improvements, an obvious one is going to be to offer this to a wider population, to include other healthcare professionals, to include other departments and even other facilities. By having a wider availability of staff, hopefully that would increase the participation and overall stress levels of the healthcare providers. I think an important thing to note from this project's results when compared to other research that's been conducted in this area is that low participation rates are not uncommon. So one of the improvements that could be made in the future is to really identify what the barriers to participation in a study similar to this would be and try to avoid those. By providing this education online, I had attempted to avoid the barriers that had been highlighted in previous studies, but there are obviously other barriers in place which resulted in having such a low number. This is an opportunity for anybody to ask any questions. This was a really interesting project to complete. It had a very small budget. It didn't require a whole lot of time, and it would be very easy to enlarge the sample size, to offer to other areas, and to be able to be generalized for different staff. So if there are no questions, thank you for listening, and I hope that you have found this interesting and can take something back to your own facility or area and maybe just think about stress a little bit more. Thank you.